I like to use analogies to explain to patients my findings and the ramifications of these findings of their eyes. It's important that the patient fully understand why they have a problem and what are the considerations of treating or not treating the problem. For instance, glaucoma. Glaucoma is a very difficult disease for a patient to understand because until the later stages of it, they're not aware of the field loss and the vision loss. So it's important that I communicate my findings to them in a way that they understand why they need to be compliant in their treatment. One thing we do in diagnosing glaucoma is we measure the thickness of the cornea. And the OCT does a great job of performing that test for us. I like to say that glaucoma corneas they come thin, average, and thick, much like the three little pigs had a straw house, a stick house, and a brick house. The three little pigs had houses made of straw, sticks, and bricks. Now, corneas come thin, average, and thick. And the cornea, the eye that is made of a straw thickness or a thin eye, suffers damage at lower pressure. So when the big bad wolf came up and blew on the straw house, the pressure exerted by the wolf on the straw caused damage very quickly. Versus the stick house, it took him a few blows, and then the brick house, no matter how hard he tried, he couldn't blow the brick house down. So what I like to do is use the analogy of these three structures to show that a patient who has a thin eye, or pachymetry, corneal pachymetry, equates to a weakened structure. In that patient, we need to be more cautious at lower pressures than we would with someone who has an average thickness eye, and versus that person who has a very hardy and thick-walled eye can withstand higher pressures such as that I equate to the three little pigs. Another analogy I like to use is that which pertains to the ganglion cell complex, or the surface layer of the retina. The surface of the retina, there's this area called the ganglion cell complex. And for different conditions, in situations in the eye, it can thin out. It can be thicker, it can be thinner. Glaucoma causes a thinning of the ganglion cell complex. Certain neurodegenerative diseases causes thinning of the ganglion cell complex. So all of the multiple sclerosis, the Alzheimer's, the Parkinson's, the ALS, and other conditions we find there's thinning of this ganglion cell complex. The ganglion cell complex emanating from those cells are the retinal nerve fiber layers. I like to say, for instance, in the exam room all the time, that the ceiling is the cornea, the retina is the surface of the desk, and down there is the brain. So the information is to come through the cornea, through the eye, strike the retina. On the retina, let's say there's 1 million little light receptors. These light receptors, when the light strikes them, information is captured. That information has to get out to the brain. Well, that information travels through what's called the retinal nerve fiber layer, and it travels through the series of wires. If you look at the ganglion cell complex, in the macula, I'm going to say that these are the retinal nerve fiber layers, and this is the optic nerve. And what we frankly see in the optic nerve is just the end of the optic nerve. If we flip it around and say this is the back of the eye, this is the bullseye, or the macula of the eye. These fibers travel in an arcing pattern, and they leave at the optic nerve. I like to say at the north pole and the south pole of the optic nerve, or there are more nerve fiber layers. So there are more nerve fibers that exit to the brain through the top and the bottom of the optic nerve, or what I call the north pole and the south pole of the nerve, versus the equator. So since there's more fibers there, the loss is more significantly seen along those superior and inferior aspects of the optic nerve. So, and there's this arcing pattern that happens. So losses of ganglion cell and a resultant loss in a nerve fiber layer, a nerve fiber, and cupping is going to occur that way. So we see that there has to be a correlation of form and function. The patient who has a stroke on the left side of their head has loss on the right side of their body. The patient who has glaucoma or some other ganglion cell-related loss is going to have loss in some of these fibers where they should travel. We know where these things travel. And so these wires help me describe that to people, and then we can look at their visual fields and correlate that with their loss and their the OCT as it pertains to the ganglion cell complex and the retinal nerve fiber layer, and then cupping along the optic nerve. Well, these fibers, if you lose these fibers, if you pull out a number of these fibers, you're going to have holes in this optic nerve. You're going to have a gap there. And what I like to say to that is it's kind of like pasta noodles. I like to enhance their understanding of the disease and the disease process by stating that the retinal nerve fiber layer is kind of like pasta noodles. So if the ceiling is the cornea and the surface of this desk is the retina, and the light travels through the cornea, through the eye, strikes the retina. Let's say there's 1 million nerve fiber layers, that 1 million light sensors where the light strikes. It's got to travel across the surface of the retina and out to the optic nerve into the brain. If you lose a light receptor, then you lose a pasta noodle. And by these pasta noodles, I have this carafe of pasta noodles, and I'm saying that this is the limits of the optic nerve, and the cup is this little hole you see in the middle here. So a loss in a light receptor causes a loss of these pasta noodles that we see spread all over the surface of the retina. All these pasta noodles travel across the surface of the retina or the nerve fiber layer, and then they exit out the optic nerve and go to the brain. You lose pasta noodles, the hole gets bigger. The hole gets bigger, you have sight loss. And so I let people know that if they forget to take their medicine, they forget to take the drops, they don't find it convenient, that they're going to lose a pasta noodle tonight. And there's only so many that you can lose. So in conclusion, I like to use all the technologies we have with the common sense analogies which will help you comprehend what's going on both physiologically and pathologically with your given condition, so that you can be comfortable and confident in the diagnosis and decision making and management and the day-to-day treatment that you need to take with your condition. I hope these tools and analogies and technology are helpful, and I'm always here to answer any question by phone, email, or consultation otherwise. Thank you, and thank you for trusting us.